Good evening. This is Dr. Nandini from NeuroGen Brain and Spine Institute, India. Welcome to this webinar on recent advances in the medical management of autism and cerebral palsy. Let us look at what new do we have. Many of you may have already been part of such a webinar before, but it's always good to relook, relearn, and clear your doubts. I will be taking questions at the end of the webinar. Please do put questions in the question and answer section or in the chat box. And once I'm through with my presentation, I will be taking up questions and answering them one by one. So to go ahead with today's webinar. So why are we here? Now, what is the purpose of being here? Either that you have a child who is special needs, who either has autism, cerebral palsy, or intellectual disability, or Down syndrome, or other global developmental disorders, or you're a professional who wants to know much more in the field of neurodevelopmental disorders, or you are a caretaker of such a child, so or a teacher, maybe a special educator. So for all of these individuals, this webinar will help understand, what's new, what's safe, and what are the possibilities. So what's the current treatment paradigm for individuals or children with neurodevelopmental disorders? Number one, you have been told time and again that there is no cure for this condition, that there is no surgical intervention, there is no cut, no operation which can treat or cure your child's condition. There is only rehabilitation or neurorehabilitation, to be specific, which you can continue to do all your life to be able to help the child recover. There are no medicines which can cure or treat this condition. Medicines are only symptomatic, help in symptoms like epilepsy or hyperactivity or spasticity or rigidity. So what is new? What is new is that it's no longer true that there is no treatment or there is no definitive option for your child. What is new is that along with rehabilitation, now you have two new team members, as I call them. So rehabilitation is not alone. Rehabilitation has been the cornerstone of treatment of neurological conditions for a long time now, but there's a limitation to how much a neurorehabilitation can achieve. And that's where you need to infuse new life, new positivity, or new sort of a reinforcement or help to neurorehabilitation. And that's where cellular therapy and oxygen-based integrative therapies work. They work in sync with rehabilitation, bringing in new enthusiasm to old experience, and thereby becoming a very powerful synergy here. So along with neurorehabilitation, when cellular therapy and integrative therapy add in, we can help to actually make cure or help the condition improve from within. For example, what you're seeing here on the screen is a fractured leg on one side. When your leg is fractured, what do? Do you start walking on it immediately? No. You need to fix the fracture first. The bone needs to heal first. And once the bone is healed, then you strengthen the muscles. Then you put pressure on the leg. If you start walking on a fractured leg, what will happen? Your leg, the bone fracture will worsen. Pain will worsen and the injury will worsen. Similar to that, the brain, if there is a damage in the brain or if part of the brain is not functioning and you pressurize your brain to work more, your brain is going to rebel. Similarly, in our children with autism or cerebral palsy, there is a limit to how much their brain is capable of functioning. There are certain areas of the brain which are functioning less. There can be a morphological damage or there can be a functional damage. What you are seeing here on the screen in the PET scan is a functional damage. The blue areas that you are seeing here denote or tell you about the areas which are functioning less. So here you can see that these areas are working less. And the second picture, you can see that the green part has increased, the blue has become green. That means, again, it indicates that these areas have now started to function. And as the brain starts to function, then you do therapy, then you do training, the brain learns better and faster. So similar to a bone injury, similar to a skin injury, we need to heal the brain, and a healed brain will respond better to therapies, training, neurorehabilitation. So the old thinking was that the central nervous system, once damaged, is incapable of regeneration. However, this is a new era. This is a new era in medicine. This is a frontier of medicine which has now infused a new thought process that there is a possibility of regeneration of the brain, of the nervous system, of the nerve, of the muscle, with the use of cellular therapy. So cellular therapy is now a tool. You know it as stem cell therapy. It comes under the field of regenerative medicine. So cellular therapy, stem cell therapy is now the new field which helps to repair, and it has infused new perception, has started helping us look at neurological condition in a different light, unlike what was told to us other that nothing is possible. But the possibilities are many, many. So earlier we had only rehabilitation. Now we have, along with rehabilitation, cellular therapy and oxygen-based therapy, which has now reversed the thought process or changed the thought process that it is possible now to reverse autism and cerebral palsy. So cellular therapy is an idea whose time has come, and I keep saying it is not science fiction. It is something which is here now, very much available for our children and for our patients. So to understand the concept of cellular therapy, it's important to understand what so far what was medicine all about, or the medical treatments so far were divided into two parts. The first was that you have medicines, you have tablets, you have injections on one side, and if that is not enough, then you have surgical treatment. Means you cut open, you remove, or you connect, or so these were the only two ways conventional allopathy or conventional medical treatment would actually work. But now, what we have in cellular therapy, it's neither a medicine or an injection or a tablet, neither it is a surgical procedure. What it is a process, a protocol, a procedure where you do not need to cut open, you do not need medicines. What you have is cellular transplantation or tissue replacement without opening up, or without even a cut or a stitch. So this is a journey from not being able to sit, or not being able to walk, not being able to go to school, not being able to speak and to go and speak and socialize. So what is this? What exactly does stem cell denote? It's stem cell denotes the stems of a tree, and with proper growth factors and with proper fertilizer and proper signaling molecules. Now there are branches, and the branches give rise to leaves and flowers and fruits. So this is the concept of cellular therapy. And we have Stephen Hawking talking about the concept of our own body having the potential to.
I have spent my life exploring the mysteries of the cosmos.
Listening to, can you hear?
But there's another universe that fascinates me. The one hidden inside our bodies. Our own personal galaxies of cells. Today, we are on the brink of a new age in medicine. An age where we will be able to heal our bodies of any illness, all because of cells inside us,
which have special powers. They are called stem cells.
So this is the power within us. We keep looking out. We keep looking at things outside our body. We keep looking at things which others will give us. But there are special powers in our body which we can harness to improve our own regenerative capacity. And that's what we are going to talk about. So what are these cells? What is the speciality of these cells? The speciality of stem cells is basically that one cell can divide into many, many, many. So one cell can become thousands of cells. And depending on where you put them, they can improve blood supply. Depending on where you put them, they can convert into that part of the body. Like if you put them in the liver, they can become liver-like cells. If you put them in the bones, they can help repair the bone. If you put them in the heart muscles, it can help repair the heart muscles. So if you put it near the brain, they can help stimulate the brain cells to function better and finally become the neurons. So these capabilities, one, they have their own capabilities, plus they have the capacity to stimulate the other cells around their vicinity to be able to function better by release of growth factors, by release of more oxygen, by formation of new blood vessels. So these are the different ways that stem cells would work. So now, how do we really understand in a layman concept what these stem cells are? Do you need medicines for them? How do they really act? So that's a question many parents keep asking us. So when you think 20-25 years back, if you needed to watch television, you need to have a television screen, right? If you needed to calculate, you needed to have a calculator. If you had to read something, you needed hardbound books. If you needed a compass, if you wanted to look at direction, you needed a compass. If you needed to check time, you needed a clock at home or a alarm clock at home. Or if you need to click a picture, you needed a camera. And so that for each of these functioning, there were different gadgets. But now, what do we have? We have an Android or we have an iPhone, and all these functions are carried out by this one small box, right? So that's what stem cells are. Stem cells are many medicines put together. That means they have action that many very different medicines will do together, and that's the beauty of this particular tool that we can use, put to good use. So, what is the promise of regenerative medicine? The promise of regenerative medicine is that healthy cells can replace or stimulate the underfunctioning cells, can replace the damaged cells, and be able to repair the part we are looking at. I'm going to talk in reference to brain or neurological conditions because that's what today's webinar is about. So, here what we can see is this is the brain, which is a PET scan of the brain, which I will be talking a little bit more about. And the blue part here is the damaged part. And when cells go and start the repair process, the blue area becomes less, the green area, which is the active area, becomes enhanced. So there can be two types of cellular transplantation, depending on where you source the cells from. One which Stephen Hawking spoke about, autologous, from our own body. So we take cells from our own body to repair our own body, other parts of our body. So, for example, if there is a skin damage, there is a non-healing wound or ulcer, we can take the blood or bone marrow and inject in around that wound area to help it to repair better, right? Similarly, if there is a damage in the brain, we can take our own bone marrow and separate out the cells that we need and inject into near the brain. So this is known as autologous, taking from our own body, putting it back into our own body. And there are other processes where you may need to take cells from outside. For example, if your bone marrow is defective, if you have a sickle cell anemia, if you have thalassemia, then your bone marrow is itself defective. So you take a matched donor or you take a sibling donor bone marrow and transfuse it into the patient's body. So that's called as allogenic transplantation from somebody else or from the donor. Now, when we look at the source of the cells, they can be taken from outside, they can be taken from embryos. So when an embryo is 3 to 4 days old, it is a bunch of cells, right? When we were in our mother's womb, 3 to 4 days, we had just bunch of cells, maybe 16 to 32 cells bunch. And from here, the whole baby is formed along with the placenta, along with the amniotic sac and covering. So when you take this embryo or blastocyst, it is called, you can derive embryonic stem cells. You can derive cells which have capacity to form each and every cell of our body. Okay, so this is but from a test tube baby. And in view of ethical concerns that you are killing an embryo when you are using a 3 to 4 day blastocyst, even if it's from a unused in vitro fertilization blastocyst, still you are killing an embryo. And that's why ethically it has not been allowed to go ahead for clinical medicine or transplantation medicine, but you can use it for purposes of research. For so many places it is being used to test out drugs. So instead of animals, you can test drugs on embryonic stem cell clusters. Also, these cells have the potential to form, multiply indefinitely and form masses of cells known as teratomas, also considered to be benign tumors. So in view of benign tumor formation and in view of ethical issues, the use of embryonic stem cell for clinical transplantation is currently not feasible. So what do we have now? We have other sources. So when this particular source sort of came to a dead end. Scientists and researchers and doctors all around the world started looking at what can we do which is ethical, what can we use which doesn't kill an embryo, and that's where we stumbled on the adult stem cells. So this particular science then shifted from the United States to the eastern part of the world, namely China, Japan, Korea, India, where we looked at other sources. So some people started using cord blood cells, and some people, like NeuroGen, we started using bone marrow cells. Now, bone marrow, you're not killing an embryo, okay? These cells have finite multiplication potential, so they will never form tumors, and we are taking the cells from the patient's own body, hence no rejection issue. So bone marrow or adult stem cells becomes a very feasible, ethical, non-risky source of cells which can be used to repair or regenerate our own body. And this is exactly what Stephen Hawking was referring to, if you remember. But of course, you have cord blood cells, cord blood, which is otherwise cord which goes into the waste basket when the child is born, and the cord which is connecting the mother and child is cut and thrown away. So this becomes a very rich source of stem cells. There are two types of stem cells which you can find: the cord blood itself, and the placental tissue or Wharton's jelly, from where the mesenchymal stem cells can be multiplied and stored. But again, this needs to be stored. Adult stem cells from bone marrow need not be stored. They are always available anytime you want it. But in terms of cord blood, you have that definite period where you need to store it, and it needs to be stored at minus 190 degrees centigrade in a cryopreservant. Now, that itself, brings about or produces or has a lot of other challenges as to get wash off completely the cryopreservant, which can be toxic. And hence, cord blood has one limited indications and uses. It can be used intravenously and mostly indicated for blood disorders. So bone marrow now becomes a very feasible and usable source for us ethically, and has no issues, and hence a good source for clinical transplantation. There is a fourth type known as induced pluripotent stem cells, for which Nobel Prize was awarded recently in 2012. This is also known as designer stem cells. Basically, these are customized stem cells from our own skin cells, which can be converted into embryonic stem cells without having any ethical issues. So your skin cells converted into embryonic stem cell by some genetic manipulation or stimulating certain genes or proteins in the nucleus of the adult cells to become an embryonic cell. Now, since the source is not an embryo, it becomes ethical. It is your own, so it doesn't get rejected. However, the challenges in terms of mutations and other issues are still being sorted and understood. But hopefully, in the future, induced pluripotent stem cells will again be a good therapeutic source. So when statements are made that stem cells are banned and they are dangerous and have a lot of side effects, what are we doing? What we are doing is putting all of these different type of cells into one basket. So we are generalizing here. So we have to make the distinction that whether this is like an alcohol or whether it is a homemade orange juice. So embryonic stem cells are akin to alcohol, where it requires lot of regulation to be used appropriately and has possible toxicity, while homemade orange juice made by a mother with lot of love, with fresh oranges, it doesn't have any side effects and has a lot of nutritional value. It is priceless but has a lot of nutritional value. So adult stem cells from bone marrow or even from adipose tissues, appropriately processed, fall under the category of a homemade orange juice. So as such, regulations are not required because this is homemade orange juice. However, in case of alcohol, you do require a lot of regulation, and strict regulations are to be adhered to. So at NeuroGen Brain and Spine Institute, we focused on using safe, simple and efficacious source of bone marrow derived mononuclear cells. So these are safe, these are non-tumorogenic. 15 years we have done over 13,500 patients without having a single tumor, and there is so much use of autologous cells or bone marrow cells, even for bone marrow transplantation. It is being used for cancer, so it cannot be tumorogenic, right? No rejection because taken from the patient's own bone marrow and easily obtained using a very thin needle, and no ethical issues because we are not killing it. So the source is the bone marrow, from where bone marrow is like thick blood, like that is a factory of the blood. That's like it's a small children not yet become the blood, and from there we separate the mononuclear cells, the red cells or red cells forming part. Settles down, and what we get is the white cell producing mononuclear cell. Those cells are then injected into the spinal fluid. Okay, now why spinal fluid? We are looking at the brain, right? We are looking at improving the brain functioning. So it's very important that we reach as near the brain as possible without damaging it any further, right? So when we looked at what are the different ways that we can give, one is of course the easiest way that many people do, that is intravenous. So intravenous is simple. Even a nursing staff can give the intravenous cells, right? So, but when you look at intravenous source, you think of, how does it reach the brain? Just think about how far it has to really traverse and through different organs in our body, right? When you put it in the hand, through the bloodstream, where will it go? It will first go to the right side of the heart, and the right side of the heart will pump it out to the lungs for purification. But 50% of the cells will get, trapped. From there, whatever does filter and come out to the left side of the brain is now then pushed through three main arteries into the whole of the body. And whatever little reaches near the brain is then again filtered through the blood-brain barrier. So these are, so finally what reaches the brain is very minuscule. Hence, what you need to inject initially has to be a huge number. For finally, what reaches the brain is limited. So this is one simple way, yes, non-risky, no risk at all, but it is efficacy is minimal. So the next option is going directly into the brain, right? That's called stereotactic method. So obviously we want to go as near the brain. However, we have to weigh the risk versus benefit ratio. So when we inject directly into the brain, we may also be going through normal tissue to reach the damaged part. And there again lies the problem. So the risks are high with direct injection, though efficiency would be higher. Okay, so on one hand, we have a simple way where efficiency is low. On the other hand, we have a risky way where efficiency high. So we want to come somewhere in between. We want to find a harmony or a balance where the risk is minimal and the efficacy is high. And that's why we look at going into the spinal fluid. So you can see here, this is the bone. In between bone is the cartilage, and through the cartilage, we are going into the spinal fluid. When we go into the spinal fluid, this is the fluid which goes all around the brain and spine. So these cells can either go into the spine or into the brain, nowhere else. So filtration is not there. It goes directly to the nervous system. And the process is very simple. It's just a very thin needle in the lower part after the spinal cord ends. So we are not touching the spinal cord. We are not touching the brain. But we are going in as near the brain as possible without damaging it. So minimally invasive, safe, no major side effects, cells home onto the injured part of the brain. And this has been studied in various studies where the cells have been connected to nanoparticles and injected into the spinal fluid, and found that majority of the cells will go to the damaged part of the brain, damaged part of the nervous system. So no dilution into lungs, liver, or spleen, or doesn't have to go through the heart and stuff. So direct access to the part where the cells are required. So direct access means targeted tissue, targeted homing, and so the number of cells required also are reasonably lesser. Okay. So what is the scientific basis for cellular therapy or regenerative medicine or stem cell therapy, whatever you may call it? The scientific basis comes from a whole lot of research, which started about 60 years back. In 1990, Dr. Thomas received the first Nobel Prize in this field of regenerative medicine for demonstration of stem cells in the bone marrow. So stem cells in the bone marrow, in fact, are the oldest and the most understood of the stem cell population in our body. Okay, so that was 1990. He got the award. In 2007, Sir Martin Evans received the Nobel Prize for the isolation of embryonic stem cell in mice. And then recently, I was talking to you about the induced pluripotent stem cells. In 2012, two scientists, Professor Gurdon and Professor Yamanaka, received this Nobel Prize. So this is the background of the rich research which has happened much since a long time. At NeuroGen, all our work is very scientifically placed. We do a lot of background research. We analyze all our data, and we keep on reviewing, revising, innovating. So this is a disruptive science. It disrupts all thought processes that people have had for years and years together. Even when I was in medical college, we were told nothing can be done for brain condition, and the amount of neurology we studied was minuscule. And we hardly ever saw an autism or a cerebral palsy or a muscular dystrophy patient. But now this disruptive science is opening up our eyes to possibilities, and that's why continued research is very critical. At NeuroGen, whatever work we do is published in peer-reviewed international journals. We have the largest number of publications in the field of neurology, 107 publications in all different disorders or conditions that we treat. So 16 in autism, cerebral palsy, 15 intellectual disability, muscular dystrophy, spinal cord injury, stroke, ALS, and other conditions as well. We have also been invited to write book chapters and specialized books which are focused on recent advances in various subjects like autism, physical disability, muscular dystrophy. And as an expert, we are invited to write chapters on regenerative medicine, stem cell, cellular therapy, and bone marrow cells. So cerebral palsy, here you can see this book, which is published by Intech, Cerebral Palsy Challenges for the Future, Stem Cell Therapy for Cerebral Palsy as a novel option was introduced by us. Again, this chapter in the book known as Physical Disabilities, Muscular Dystrophy. So this is a Prime Minister of India, Shri Narendra Modi, to whom Professor Dr. Alok Sharma is presenting the book that we have written on stem cell therapy in neurological condition. And there is a lot of support from the Premier, from the Prime Minister, as well as from the Health Minister for the work that is happening in India for the regenerative medicine and stem cell. When Prime Minister came into power in 2014, he actually went and met Professor Yamanaka in Japan to understand the process of how we can use this science to treat incurable conditions like sickle cell anemia. And that science has been brought to India, and a lot of research is happening in that field. This is the preface that Prime Minister Narendra Modi has written for our book on muscular dystrophy.
मैं जापान गया।
So this is him.
तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी खोज हमारे काम आ सकती है। हम गए तो वहाँ गए, उनसे चर्चा की, और बेंगलोर के हमारे साइंस इंस्टीट्यूट था।
So how is the treatment done? Yes, there is a lot of background, there's a lot of research, but of course parents finally want to know, how is the treatment done? Is it simple? Is it complicated? Will my child have any problem? So from our experience of last 15 years, and as I introduced earlier, we are using the bone marrow as a source of the stem cells. So we take bone marrow from the hip bone. So it is not from the back, it is from the front. So not from the spine. I want to emphasize, it's not from the spine, it is from the front of the hip. So if you take your hand and touch in front, the right side or the left side, you will feel a bone in the front. Okay, that's the bone which is very superficial, from where the bone marrow is aspirated. And then these cells are separated within a few hours and then injected in the lower back. Okay, lower back injection using a very thin needle. So taking out from the front, injecting in the lower back. So it's a simple procedure, no cut, no stitches, and this is done under short general anesthesia. So here you can see the child is sleeping normally, right? From the front, the bone marrow is aspirated. Here the sensor separation is happening, and once they are separated, injected using a very thin needle. It is thinner than our needle from which we take the blood out. Bone marrow aspiration, separation, these. You can see it is being separated here, centrifuge, and what you get is this after proper cleansing. And counted and injected. So let's look at, what are results in autism and in cerebral palsy. Autism, as we know, is a condition which has issues of problems of communication, social interaction, and comprehension and learning. Some are typically diagnosed with around the age of 3 now. Earlier, in fact, now around 2.5 itself. It's a spectrum disorder, mild, moderate, and severe. Each child is different, and somehow it's more often diagnosed in males than in females. So poor social interaction, impaired communication, and restricted repetitive behavior, these are the hallmarks or triad of impairments in autism. So now, why do we need to look at definitive treatment options? Because the numbers are increasing, and they're increasing alarmingly. So in 2004, the prevalence as per the CDC Atlanta data was 1 in 166. In 2012, 1 in 88, 2014, 1 in 68, 2018, 1 in 59, 2020, 1 in 54, 2023, it is 1 in 36. So you can see every 2 years, it is increasing at a very rapid rate. 70%, 70 million people in the world are on the spectrum, 1% of the world's population. So it's very important to understand, yes, why it is happening, and that is a different webinar altogether. But what can we do to help children or individuals with autism get mainstreamed to be able to lead a functional, independent life? And that's what we are looking at. Now, the causes could be, of course, it could be genetic, it could be environmental, it could be a combination of both. So there are genetic possibilities. 10 to 20% of autism appears to have some genetic predisposition, but environmental factors always coincide. Epigenetics and environment plays a big role in, in the manifestation of autism. And what are the environmental factors? Prenatal, antenatal causes, intestinal dysfunction in the mother and in the child, exposure to toxic chemicals when the child is in the mother's womb, possible electromagnetic radiation from phones and gadgets around us. So what is new? There are a lot of things which are old and which keep being discussed. But let's look ahead. What can we do for our child? First, let us understand autism in terms of the cellular pathology, what is happening inside the brain, and then how do you correct it using cellular therapy. So this is original research done at NeuroGen Brain and Spine Institute, and you can see that this is the brain when you see from the side view. So what you are seeing is like this, okay? So this is the front, what you see here on the left side, and then in the back, the small part, small brain. So the front part here is a frontal lobe, frontal, parietal, temporal, occipital skull, and this is a cerebellum. So the blue areas, and the darker the blue, more lesser the functioning or lesser the metabolism indicates, the lower functional or damaged part of the brain. And the areas which are green, yellow, and red indicate good functioning brain. So what are we seeing is that deeper parts of the brain are affected. These parts are actually developed later in life, especially when the child comes out of the womb and starts basically interacting with the surrounding, interacting with the world, is when these areas start to function and develop better. So what we have found is that the brain structure is fine, it is the functioning which is low, and these areas corroborate or correlate exactly with the function which is affected. So if you see the cerebellum, many times you have problem with fine motor activity, coordination, balance, articulation, okay, chewing, swallowing is many times delayed. So this is the cerebellum. The central part of the brain is about understanding, learning, comprehension, social awareness, emotional expression. So these are the areas, and processing of information. So these are typically the areas which are functioning less. And this we have studied and published in the World Journal of Nuclear Medicine in the year 2020. And to summarize what we have observed, and that's where our strategy of intervention becomes very critical, is that earlier, when you look at the brain functioning, this is the blue indicates the brain functioning of neurotypical children. The orange indicates the brain functioning of the children with autism. So you can see neurotypical children, the brain functioning is at a particular point and keeps on increasing fast up till the age of 10. And then it keeps on increasing, however, at a slightly slower pace up till the age of 15. Okay. When you look at a child with autism, initially the metabolism is high and then it keeps slowly going down. So there is a point when it is reversible in terms of complete reversible in terms of function, but there's a point as a gap increases, it may not be completely reversible. So that's why earlier you treat, lesser the gap and more possibility of reversing. So that's why before 10 is the best time. In fact, best time is before 5, the second best before 10 years of age. So treatment for autism is not one thing. It's a multi disciplinary approach is very, very important. You have to do a lot of things together for them to come together and work together. So even when we do a lot of therapies, training, are we doing enough? The rehabilitation medicines help from outside, but they don't really alter or improve the brain functioning from inside. They do not repair the underlying damage, and that's where the role of cellular therapy and integrative therapy comes in. So the first ever publication in the world where we looked at autologous, what we're doing, autologous bone marrow-derived mononuclear cells came in the year 2013. So it's been now 10 years and more since, 20 years now. 2013 is 10 years, yeah. 10 years since we have published this and shown that cellular therapy using bone marrow, the child's own bone marrow, has good prospects. So where we looked at 32 children or individuals and looked at functionally how do they improve, and we found improvement in different scales of the ISA. ISA is the Indian Scale for Autism Assessment, and which looks at the following parameters: social relationship, reciprocity, emotional responsiveness, speech language communication, behavior, sensory aspect, and cognitive component. All these components do improve to a significant level after the cellular therapy. And that's what we see. And the second scientific publication, was published in the American Journal of Stem Cells in the year 2020, where we looked at 254 individuals with autism over a period of average follow-up of 7.5 months. And we found again that there's improvement in social interaction, eye contact, attention concentration, very good improvement in sitting tolerance, hyperactivity reduces, self-injurious behavior reduces, speech and communication improves. There is a significant improvement in the scores as well. What we found very typically is that younger the child, better the result. Mild, moderate improve equally. So children less than 5 years show almost 97 to 98% possibility of improvement. Between 5 to 10 years, the possibility goes down to 94%. Between 10 to 15 years, go down to 90%. So earlier you treat, definitely better the results. Both male and female show almost equal chances of improvement. Earlier you come after diagnosis, better the results. So if you've diagnosed today and you come within a year, there is a 97 to 100% chance that you should be able to improve and reverse the condition. If you come between 1 to 5 years after the diagnosis, it is 95%. And if you come 5 years and later, the possibility of improvement becomes 90%. So these are the publications. There are a lot of evidence. Of course, different people use different kinds of source of the cells. However, there is a lot of work which has happened after our first publication. Second came from China, third from Italy, fourth from the US, fifth from the US, sixth from India, seventh from Vietnam, eighth from Iran, ninth from US. These are all our publications. So a few case reports for your understanding of a long-term follow-up. This is, I won't even say child, he's a young man now, 19 years old, from the US. He came to us first when he was 11 years old. And he had a CARS 1 score of 26.5, which we consider at that time as like a mild to moderate autism. So he had fleeting eye contact, low self-awareness, no response to name, sensory issues. He had toe walking, he had eye cornering, tactile defensiveness, stereotypical behavior, a lot of self-talk, aggressiveness like screaming, kicking, breakdown, temper tantrums, limited vocabulary, low fluency, hyperactivity, poor command following. In 5 months, it was found that his reading level went from third grade, fourth month, to seventh grade for 1 month. His temper tantrums reduced, eye contact improved. He started exploring new foods, sensory issues reduced. He started wearing full clothes. He started wearing sneakers. Earlier, he would wear only Crocs. His personal judgment, his understanding of relationships improved, cognition, learning. He started learning languages where he could only earlier learn English. He started learning Spanish as well. He could chop himself. His problem solving improved, better emotion, better coordination. He could ride a bicycle, independent in his daily activities. Brain functioning also improved. His over a period of 2 years, his scoring in school also went up to A grade. He went from a special school to a regular class. So over a period of, you can see 2-3 years, he went from mild autism to no autism. So that's what is possible if you continue to work. And this is his photo when he passed his school. He graduated from school, and now he has got admission in college. So this is a child who is now completely out of autism and is doing beautifully. He's a part of a choir. He can sing. He's gone for various trips with the choir. This was made when he was preparing for his college essays, and the recent update is that he's got admission in colleges too. So this is his mother talking, almost 2-3 years back about his progress.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the third grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
These are things I've already told you about. So this was just an example. There are many, many examples.
We went to
which you will find on our website. Please do go and check it out, because I want to keep some time for your questions. So I'm going to go ahead and talk a little bit about cerebral palsy, and then about the integrative therapy. So I'm going to skip on the videos. These are videos which are all available online, so you can see. Cerebral palsy is, of course, damage to the brain caused by problems before birth, during birth, or immediately after birth. This could be because of lack of oxygen, or the brain not developing because of toxic infections when the child was in the womb, or problems shortly after birth in terms of seizures or hypoglycemia. And depending on the part of the brain which is damaged, you will see a manifestation of physical affectation as well as cognitive affectation. So in cerebral palsy, we find that different type of cerebral palsy respond differently. Generally, we see that children who have no neck holding or are quadriplegic, we do see improvement in neck holding and understanding and oromotors, and then sitting and use of hand, and then standing and walking. So children with quadriplegia will take more time to improve because parts of the brain which are damaged are much more. The difference is that in cerebral palsy, there is a physical damage to the structure as well. So not only the structure, the function and functioning connections are all affected. Along with that, there are many times seizures comorbidity which accompanies more often than not. So in diplegic cerebral palsy, when the child is okay in the upper body but more affected in the lower body, the potential or improvement is faster and you see better results. In ataxic cerebral palsy, I will show you a few videos. This is the brain. You can see the brain scan. The blue and black area indicate damage, but the black is completely dead, but the blue is functioning less. So before this is before the treatment, and this is 6 months later. The blue areas have now become green. So you can see here. This is the brain when you see from side view. You can see these areas are all damaged or working less before the treatment, and you can see that it is now improved. So this is 2015 data, and then all these, we have other publications. Let's see a few examples. So this is a child who came to us when he was 7 years old. He's from West Bengal, and he came with a GMFC is of 4. What does that mean? Now, GMFC is the mildest gross motor functional score. Mildest is 1, and the severest is 5. So 4 would be somewhere towards the severe, but a little less severe. This child was unable to sit without support. He could not stand. He could not walk. He had poor hand-eye coordination. He was unable to speak. He had poor command following. He was homeschooled because he could not speak, or neither could he sit and walk. So after the treatment, the first thing that we saw is that ability to sit improved. Then he was able to, he could stand now without support, without external human support, but with the support of a walker. He was earlier he was unable to speak. Now he started speaking and speaking in sentences. So comprehension and speech both improved. He was homeschooled due to physical limitations. Now he started going to school. Improved coordination, hand manipulation, balance, cognition improved. So a child who was confined within home is now able to go to school. So that's a good shift in progress. So that led to his GMFCS score, gross motor functional classification system score, from 4 to 3. And his balance, you can see an improvement in balance from 4 to 11. His functional measures improved from 44 to 59. So the scores overall improved. This was his brain scan. This shows, why he had so much improvement. This is a scan before the treatment, the upper part. You can see that the blue areas are more, and even the green areas are not really solidly working. So this is before the treatment, and this is later when we take the scan again. You can see the whole of the brain is now active. Right, the green, yellow, red indicates good functioning brain. So as if the brain has lighted up, and as the brain functioning improves, now the therapies will help to connect, activate, and you will see faster and better results. This is a child from Kenya who came to us when he was 14 years old, and he came to us when he was on the wheelchair, and after the treatment we worked on him in terms of therapy, and he was able to sit, he was able to use his hand, wear his own clothes, pack his own bag, use his hand to do fine motor activities, do simple tasks like going to the fridge, taking the bottle of water, opening it. So functional improvement, very, very important, so that the child or individual becomes independent. You can see now walking without support, and that was a great achievement for him. Again, this is a child from Kenya, 7-year-old, who could never stand. Here, first time when he came, is standing with full support from the back. And slowly then he started walking with support, and then without support. First inside the house and then outside the house. So This is the child. This is the kind of improvement that if you are consistent with your therapies after the cellular therapy, you will be able to see. So this is about cerebral palsy and intellectual disability. Now, see, all these neurodevelopmental disorders are a spectrum. Okay, very, very severe would be cerebral palsy. Then a milder version would be intellectual disability, then autism, then ADHD, slow learner. So this will all be a spectrum in neurodevelopmental disorder. In intellectual disability also, you can see that there is a developmental disability for cognition, understanding, and adaptation. So this is the first ever publication in the world which showed that autologous cell therapy can help in intellectual disability. And what we showed was a qualitative and quantitative difference when you do only rehabilitation and when you do rehabilitation with cellular therapy. So there were two groups here where you can see the blue is the intervention group where the cellular therapy along with rehabilitation, while the orange is the rehabilitation group. So when you see that there is an improvement, if you see the orange graph, there is no improvement in 20% of the patients who did only rehabilitation, while 80% showed improvement. Majority of this 80% showed mild improvement and only 30% showed significant improvement. So improvement was there with only rehabilitation. But when you add the cellular therapy, you find that all of the individuals improved and a majority improved significantly. So that's the qualitative and quantitative difference in the type of improvement that you see with the cellular intervention along with rehabilitation. So you can see the brain scan here, the blue and the blue areas. You can see all this looks like, brain is mottled and eaten up. And after the treatment, you can see the brain reduced. So the whole brain is now activated. Here too. So this is the first of our publication, as I said. After that, we have published some case reports as well. Okay. So now I want to actually shift to talking to a little bit about integrative therapy. So I'm just going to go directly to integrative therapy. Screen share. Just give me a moment, please. Go to screen share. Screen share. Yeah. So I'm sorry, we are back on track now. Are we back on track? No. So adverse events. So adverse events with cellular therapy, there are no major complications, no neurological deterioration or reversal, but we do see that those who have a history of epilepsy or seizures or whose EEG is abnormal, there is a 3 to 6% chance that there may be a transient increase in seizure within 6 months of the cellular therapy. In such patients, we do put them on anti-epileptic cover, that is medications for the first 6 months after the treatment. There is a possibility of something known as a spinal headache as a part of the procedure. This is a headache which is very typical. If you sit, you have a headache. If you lie down, you feel better. It may come between 24 to 72 hours after the treatment and is corrected by fluids and medication. So this is again transient. There can be a little pain in the back and nausea, vomiting. These are the few things which are reversible and can be taken care of. Now about integrative therapy, which is the second part of the new treatment that has been added to neurorehabilitation. So we saw cellular therapy and now we are looking at the integrative therapy. Integrative therapy in children basically consists of hyperbaric oxygen therapy, ozone therapy, and deep tissue mobilization. In hyperbaric oxygen therapy, you are seeing here a chamber. Now, this is a chamber in which the patient, if it's a child, along with the parent or a caretaker will go inside and will be exposed to 100% oxygen at slowly increasing pressure increased every day. So what are we looking at here? So this is a picture which depicts what exactly happens in our body when oxygen is delivered at increasing pressure. So you can see the upper part here. This is the blood vessel or the artery, and you can see the red blood cells carrying oxygen. You can see these two dots. These are oxygen. So here in the upper, where we are breathing normal 20% oxygen at normal pressure, the oxygen will go only into the red blood cells. Okay. Now, when we increase the pressure, the oxygen is pushed into the bloodstream, and you can see along with the red blood cells, the whole plasma is now diffused with oxygen. That is the difference. Now, when the whole liquid medium is diffused with oxygen, so the upper part that you are seeing is the artery, where you can see that only in the normal oxygen pressure, the red blood cells are carrying the oxygen. As we know, oxygen connects with the hemoglobin, and the hemoglobin is inside the red blood cells. So the upper part or the upper artery is showing oxygenation at normal pressure. The lower one is showing oxygenation at increased pressure. So as the pressure increases, oxygen is diffused into the plasma, and you can see the whole plasma is now flooded with oxygen. And oxygen is the molecule which is required for healing of any ailment in our body. So oxygenation is critical, and increased oxygenation via the hyperbaric oxygen therapy will help diffuse oxygen into even the parts where the normal cells are unable to reach, and that in turn helps to stimulate rejuvenation in our body. What it does to the cells which is infused or transplanted is that it helps the cells survive longer, better, and work better. And on its own, the hyperbaric oxygen will stimulate the stem cells in our body. Okay, is the screen moving? So you can see here, in the process of hyperbaric oxygen has been being used routinely for anti-aging processes. It has been used for wound healing processes, and in severe conditions like comatose patients post-head injury. Now, what happens is that what you are seeing here is a DNA. You can see the X, and at the tip of the X, you can see a red part that is a telomere. The telomere, as the cell ages, as our cell starts dying or ages, becomes older, the telomere or the red part keeps on shrinking, and when the telomere shrinks to the minimum, the cell dies. Okay, so what is the hyperbaric oxygen doing is increasing the telomere size, keeping the cells surviving for a longer time, and thereby enhancing their effect. So this is the hyperbaric chamber. This is known as a monoplace chamber, where only one patient can go in at a time. There is the provision in other places for a multiplace chamber, which is like a room where people will be sitting and using a mask or a hood to introduce the oxygen at increased pressure. In monoplace chamber, oxygen is there throughout the chamber, and you are breathing without a mask because the whole oxygen is a pressurized oxygen. What are the benefits? It strengthens immunity, it stimulates oxygenation, improves metabolism, increases energy levels, reduces fatigue, and improves overall functioning. This is in general. And for the cells, as I said, for the stem cells, it helps the survival of the stem cells. The second way of improving oxygenation and stimulating the stem cells is through the ozone therapy. And what is ozone? You can see here. Before this, I showed you oxygen is 2 molecules. Right here, ozone, what are you seeing? 3 atoms of oxygen. Yeah, here one has a proper stable connection with you can see, which is indicated by 2 connections between the oxygen, and this connection here is just single. So that's an unstable connection which breaks once the ozone goes into our body. So this is, you can see here, O2, O3. So basically ozone is O2 converted into O3. Here you can see 2 and 1. This is the unstable bond or connection. So medical oxygen is converted into medical ozone. This is not the ozone in the environment. This is ozone created by us for therapeutic purposes using oxygen, in the pure oxygen in the cylinder. So this is activated oxygen, and this, when it goes into the body, it divides into oxygen and O minus, which is the unstable part and is an active component which kills the bacteria, viruses, fungus we do not want in our body, especially when you put through the gut or put intravenous. That's what it does. Reduces inflammation and swelling. It reduces the clots. It thins out the blood. It is a blood thinner, and it acts as an antioxidant. So all of these together, it helps to strengthen the immunity of our body, as well as it kills the gut. When we put through the gut, it kills the gut bacteria and viruses and fungus. So it's a natural germicidal without any chemical effect. And this is the ozonator you can see here. This is where the oxygen goes in and it comes out as an ozone. So the gut cleansing part using hydrochlorine is more for adults and not for children. This is done as a part of anti-aging processes. However, in children, the ozone therapy given rectally itself works as a gut cleansing tool. Deep tissue mobilization or acupressure is again giving pressure at certain points, whereby it also improves the circulation, helps relax the child, and induces a increased blood flow in the body, which again helps the rejuvenation process. Vitamins is again for adults. So generally, the protocol that we follow for neurodevelopmental disorders like autism, cerebral palsy, and global developmental delay, intellectual disability is 10 sessions of hyperbaric oxygen, 10 sessions of ozone, and 8 sessions of deep tissue mobilization, along with cellular therapy and neurorehabilitation over a 2-week period. So this is NeuroGen Brain and Spine Institute. All of you are welcome here. We treat our patients like our family. When we say it, we mean it, and you will feel it when you come here. We have treated over 13,000 plus patients from 75 different countries, and we have all the processes in-house except the brain scans. Yeah, so we have the stay in-house. This is the place very near a beautiful lake. Navi Mumbai is away from Mumbai, so it has a connectivity to Mumbai. The positives of Mumbai, hopefully not so much of crowding. This is our operation theater where we do the procedure, and just next to that, adjacent to that, is the cell laboratory or sensor laboratory where the processing happens. So the operation theater and the cell laboratory is connected, and all we do is send the bone marrow through a passwalk. So nothing goes out of that particular complex. Comprehensive rehabilitation, we believe in neurorehabilitation. We believe that neurorehabilitation stimulates the cellular therapy enhances the effect of the neurorehabilitation. So they go hand in hand. It is a teamwork. We cannot really distinguish what component is neurorehab and what is cellular therapy and now what is oxygen-based therapy. They work seamlessly as a team, and the team wins. The best team which works together wins. So we have a combination of all professionals, therapy, clinical, nursing staff, all nutritionists working together. So this is our physiotherapy department. This is our occupational therapy department. This is our Autism Child Development Center. Aquatic therapy. For adult patients, spinal cord injury, walking track, which is very specialized walking process for adults, especially spinal cord injury patients. Sensory integration, very crucial part of children and a pediatric occupational therapy. Teaching the child how to do activities of daily living. Speech therapy, art therapy, and special education, dance therapy. Of course, along with NeuroGen, we have KLS, Wellness, and NeuroGen NX, where we do both cellular therapy for neurological patients as well as the process of anti-aging for adults. So both the child and the parent can be treated here, because parents also need a break. They need to be taken care of so that they can take care of their children better. And I talked about all of this with them. So all our books and publications are online. We've written many books, both for professionals as well as for parents. Please do look upon that. We believe in sharing our knowledge, and this is our core team: Dr. Sharma, myself, Dr. Prerna, Dr. Himanshu. Unfortunately, we lost Dr. Jacob, but still he's part of us. He was the head of neurorehabilitation. So we are GLP, GMP certified and ISO certified, and we have also increased credibility because of awards, both international and national awards. So anybody who wants to reach us can reach us at these following email IDs and phone numbers. We will be reaching out to you as well. This is each patient or each person who reaches out to us is connected to a coordinator and explain about the treatment process. It's a 1-week program or a 2-week program. And why NeuroGen? Of course, there are many people who are doing cellular therapy. So what's different about NeuroGen? What is different is that we are focused only on neurological conditions. When you come here, you will not see other conditions like orthopedics or liver or diabetes being treated here. Our focus is only neurological. What we do is scientifically validated. We have the largest number of scientific publications. That is something you must ask when we talk with the scientific data with us. We have written book chapters in various international books on cellular therapy. We treat, as I said, only neuro cases. We use safe autologous cells which are injected into the spinal fluid, thereby reaching the brain directly. Along with that, we combine comprehensive rehabilitation and oxygen-based therapies. We have been doing this for the last 15 years, having experience of having treated 13,000 patients from 75 different countries. And it's not a single person's work. It is a group. It's a team work. Senior experienced professionals across specialty, looking at supervising everything that is happening. We keep on researching what new synergistic treatments can be done together. And most importantly, we are monitored by the government certified institutional review board, or the institutional ethics committee is constantly monitoring the work that we are doing. So we believe that adult cell therapy is a safe and effective treatment, and that has been that is something which we have seen and experienced last 15 years, and that's experience I've shared with you. And to believe, as Mahatma Gandhi said, to believe that what has not occurred in history will not occur at all is to argue disbelief in the dignity of man. So it is possible to reverse autism. It is possible to get your child or individual to lead
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So this particular, I end with Obama's speech for two particular reasons. One, that we have to look at what's positive. We have to look ahead for what is positive. What happens is that we remember the ban, but we don't remember the lifting of the ban always, isn't it? So it's important to keep on remembering that this ban was lifted and this was reversed, and that led to a lot of positive way ahead. However, US is 10 years behind us in this. So what the ban which happened in 2001 was reversed in 2008. So 8 to 10 years, nothing really happened there in terms of regenerative medicine. So we are much ahead in that. And that what we are looking at is doing the impossible, what is terminal and incurable to make it curable. Okay, so thank you for patient hearing, and I will be now taking questions. So, okay, let me start from the beginning. Marjorie says, can global developmental delay with cerebral palsy and lead a normal life? See, we have to look at, definitely there are possibilities. Even in impossible, there is a possible. But we need to look at what is the age of the child and where is the child now. If we start intervention early enough, it is possible for an individual with cerebral palsy to lead a good productive life. We have many, many individuals who are now working, who have got married, who are living a professional life. There may be some difficulties, but it is possible to lead an independent life. Yes. Amit is saying, will there be a time when you will be able to inject cells directly into the brain? Amit, there has been a time, even before, where cells were injected into the brain. And this was done in a center in Germany known as Excel Center for Regenerative Medicine. However, unfortunately, what happened was, because it's a bit of a high risk condition and it's known as a stereotactic injection, the center lost a child, and hence the work was closed. So it is possible, and out of 100, maybe 90 will be fine or 95 will be fine, but we cannot afford to lose that one or two child, because the procedure is very risky. The other thing you must understand, when we are injecting into the brain, we'll be injecting only in one area. Most of the time, both in cerebral palsy, autism, or intellectual disability, the problem is much more diffuse. So with the injection directly into the brain, you can't really reach all the areas of the brain. While when you're injecting into the spinal fluid, you can reach to all the areas, because the cerebrospinal fluid floods the brain and really bathes the brain around, and the cells go along with it. So not only is intrathecal simple, but it is also more effective in terms of being able to reach small areas as well. What happens when you do not get very good viable stem cells? Do you repeat the bone marrow aspiration? So the way to try and ensure that the number of cells are high, Farida, is by stimulating the bone marrow. We stimulate the bone marrow with granulocyte colony stimulating factor, so that gives us a good amount of cells. We have not. There's only once when we did not have good cells, because the bone marrow itself was defective, and we abandoned the process. I remember only one time that happened. So that's why we don't leave it to chance. We stimulate the bone marrow. How sure are we that this procedure will work? It's an invasive procedure, especially to perform it on autistic. It will be a big thing. Just wanted more clarity. How sure are we that the procedure will work is based on experience and based on our scientific data and publication. As I told you, children less than 5 years, the possibility that it will work is 90 to 95%. For those who are between 5 to 10 years, the possibility is about 90%. So yes, as the age increases, possibility reduces by 5% every time. And so that's what we can assure you. Whether it will work in an individual patient, really nobody can say that. But out of 100, that's how scientifically the data is ascertained. Out of 100, yes. So for example, in case of any procedure that you may do, like a CABG or even any procedure or surgery, nobody can really say 100% that it will work in a particular patient. So by and large, I would say 90% of the individuals it will work. The procedure is invasive, but it's called minimally invasive. One of you, in fact, wants to make it maximally invasive through the brain. We don't want to do that. So keeping safety in view, intrathecal injection is very safe. I can assure you of that. We have been doing it for 15 years, and under proper supervision, my expert doesn't have any long-term implications. What are the risks associated with the incidence of seizures after cellular therapy? I did talk about that. If you saw, there is a possibility, 3 to 6% possibility of having a seizure after the treatment within 6 months, if there is a history of seizure or if EEG is abnormal. If we look at individuals or children who have no history of seizure or whose EEG is normal, our experience would say 0.2%. So out of 1,000, 2 individuals may have seizure without having a predisposition to seizures. So 2 out of 1,000. If you look at neurodevelopmental disorders, children who have a neurodevelopmental condition, even without the cellular therapy, there is a 20% chance that they will develop seizure anytime in their lifetime, okay, without any treatment also. So as opposed to lay person, that is 1 to 2. So considering that after cellular therapy, the possibility is much, much lesser. How long is the EEG done for? Can it pick up silent seizures? EEG typically is done for a 30-minute time. During that 30-minute, if there are silent seizures, that will get picked up. But if silent seizures are there not during the 30-minute, it may not get picked up. There are times when people do 24-hour EEGs also and do not pick up seizures, even though the individual or child has clinical seizures. So yes, EEG is a 30-minute thing. You can do only sampling. You can't do 24 hours or 3 days EEG unless it is indicated. It's difficult in a child. So 30, we do, I would say out of maybe 40 to 50 EEGs that we may be doing, or say 100 EEGs in a month, 1 or 2 who have never had a history, we do pick up them to be abnormal EEGs. So I would say it's a 1% chance. What is the success rate in 13K that got treated? So 13K is all neurological conditions. So I did tell about success rate in different conditions. In autism, broadly 90%. Similarly, in cerebral palsy, in intellectual disability, about 85%. Muscular dystrophy, the problem is a degenerative condition. So the protocol or the goal will be different. So 85 to 90% in muscular dystrophy. So in motor neuron disease, only 50%. So it varies from condition to condition. Does treatment help kids with GTD or in kids with genetic cause? Yes, it does. If it is a non-progressive condition, both in GTD or GTD due to genetic cause, yes, cell therapy works. Can you treat a 3 to 4 year old? Yes, Rachel, we can treat a 3 to 4 year old. The youngest autism that we have treated is a 15-month. The youngest cerebral palsy that we have treated is a 1 year. 3 years child with autism treatment, how long it takes to finish the treatment if patient is from interstate or overseas? So the first time that you come, you will have to stay with us a minimum of 1 week or a maximum of 2 weeks. So that's the time, Sherry, that you will need to stay with us. What is a long-term side effect that you have seen in kids that you have treated? No long-term side effects. That's the most important thing. We have been following up patients for 15 years, adults as well as children. And there are no long-term side effects because these are their own cells. They have limited multiplication potential. They will integrate into the brain and they will not form tumors ever. Who has been found so far about what is specifically wrong? What has been found? What is specifically wrong in autistic brain? Is there evidence of damage or inflammation? Lots of people say, what exactly is cellular therapy trying to fix? Quick. Did you join very late? I explained everything of that what parts of the brain are affected. Yes, there are parts of the brain which are functioning less, hypofunctioning. The inflammation theory is also there, but that eventually leads to hypofunctioning. And cellular therapy is helping the brain to improve or functioning better. We will resend this video to you. Please do watch it again. Mame is asking, how long is the procedure? Is it a one-time procedure or do we have to come back? And how our cells are healthy to give back from autistic child back to the child? The procedure, the treatment procedure, the cellular therapy, 10 minutes of aspiration, 10 minutes of injection, in between about 2.5 to 4 hours in between for the separation part. Okay. depending on the extent of the brain involvement, you may need 1, 2, or 3 procedures over a period of 2 years. So that we will know when we assess the child, when the child comes to us, we do a brain scan, and based on that, we can maybe give you a understanding that whether the child is severe or moderate or mild based on our experience. Whether the cells are healthy to give back to autistic child, please understand that your child is healthy, right? He's running around, he's otherwise active. The only thing is that his brain is functioning less. Because if he would not have been healthy, you would have to keep giving him blood. So what are we taking? We are taking bone marrow, which is forming normal blood. We are taking the cells which will eventually form the blood. We are taking the baby cells of the bone marrow. Bone marrow is the factory of the blood. We are taking the baby cells from there and putting it into the spinal fluid, because these cells on their own cannot cross what is known as the blood-brain barrier. So the brain is a very, very delicate organ, and it is covered by layers known as meninges, which forms a protective covering around it. So when we are going into the spinal fluid, we are actually crossing 2 of the main thick layers which protect the brain around it and injecting the cells so that the cells can reach the brain. So there is nothing wrong with the bone marrow. If there is something wrong with the bone marrow, we cannot use. And we check it by doing the blood test and ensuring there's no infection. So your child is healthy otherwise, isn't it? In fact, he's quite hyper, he's running around. Even in case of cerebral palsy, the problem is the damage in the brain. Okay, the problem is not in the bone marrow. My child has autism, very hyperactive, very low concentration. Can this therapy work, solve my child's condition? Yes. It can help the child's understanding improve, comprehension improves beautifully, learning, attention span, following commands. Learning improves beautifully after this. In fact, the brain starts taking information from the surrounding. Processing of information improves. Communication improves. Yes. Kavita is saying, my son is 9 years, mild to moderate autism. He is little verbal for only needs, but sometimes self-harming due to frustration. He's on medication like risperidone, and doctor said he has tendency for bipolar. Would like to know how effective self-help will be for him. So, Kavita, yes, I believe that your child will be benefited, because if you are able to improve his comprehension and his communication, his self-harming will reduce. We may have to keep him on medication for some time till his comprehension improves. 9 years, I would say that if we have to help him, we need to hurry, because we want to correct the brain functioning before the child hits puberty. So it's, if we are thinking and considering, better to do earlier rather than wait. Do we have only in India, or do we have clinic in different parts of the world? Currently only in India, but we are of course exploring other centers, hopefully soon in Nassau, Bahama. We are going there next week to explore. We already have ethics clearance even before COVID, but we are going to try and make it work soon. So hopefully in the next 6-8 months, we should be functional in Bahamas. Upfront, as we have EEG, SERA, MRI, blood reports from Chandigarh neurospecialist. Do we need to provide any reports? Yes, Sherry. We will reach out to you. One of the coordinator will reach out to you, and you can share all that reports, and we will evaluate it. Contact details will be sent to you, and email will come to you by tomorrow, maximum day after, and we will connect. For a non-verbal autistic 5 years boy, how many cell therapy rounds are required to make him become verbal? Okay, you have to understand that speech in autism is a very complicated process. For a 5-year child, we need to first assess what his social age is. Children, many a times, because comprehension is very low, the social age is much less than 2 years also. So in order to make the child verbal, first we need to improve comprehension, learning, oromotor, and then the speech will come. So maybe a year plus for the speech to come is what we believe. Speech is not the first thing to come. First the comprehension, learning, and then the speech. But more often than not, more recently, in fact, we have seen speech also come faster. in a 5-year-old child more likely than a 9 or a 10-year-old child. So cure is not the word actually we would use. We are looking at making the child functional and come off the spectrum. So below 5 years, I would give the child at least a 3-year time to be able to reverse his autism maximally. Is MRI or any kind of test required prior to the procedure? Yes, we will be doing a whole battery of tests, MRI, PET scan, EEG, blood workup, all of that before the treatment and clinical assessment. Hawa, my daughter is always aggressive, attacking her siblings whenever she needs something. Yeah, because she is possibly not able to let you know or communicate what she wants. And if you look at a child who is aggressive, there are two possibilities. One, that the child social age must, if you see a really small child and if he or she needs something, throws a tantrum or tries to grab attention by hitting. So either that her social age is very low, or that she has frustration tolerance is very less and she's not able to communicate, that's why aggressive. So age will matter. If the child is in the teenage, a lot of hormonal changes may also lead to these kind of behaviors. That's why changing behaviors need to happen early on. Plus, the comprehension has to improve. So I believe comprehension is a root issue everywhere. Unless the understanding improves, communication and the behaviors cannot be changed. So all of that first needs to be addressed. And cellular therapy helps to improve comprehension first, learning, following commands, and then they are able to impulse control. Many times, child with autism doesn't have impulse control. That means he or she is unable to control the impulse of trying to hit others or hit himself or herself. So that will happen when understanding improves and child is able to control his or her emotions. So that's why the brain needs to improve. Whatever you do in terms of medication or therapy, if the brain is functioning less, there is very limited that you can do for your child. Do you put a child on anesthesia for MRI? So does it mean 3 total anesthesia including MRI? The MRI is short, about 15 to 20 minutes. Yes, we will need to sedate the child. So this is a short intravenous sedation with little general anesthesia. MRI, then 10 minutes for PET scan. So 20 minutes for MRI, 10 minutes for PET scan. And during the procedure, yes, it is intravenous sedation with 10 minutes of general anesthesia and then again 5 minutes. So these are very short anesthesias which get removed from the body. In fact, in 10-15 minutes, the child is up. I think I've answered. If I have not answered any question, please do write again or remind me. I'm hoping I have not missed any questions. Yes, I think I'm done with all the questions. Anything more? Please do raise a hand if anybody wants to ask question and I should wait. Otherwise, this video recording of this webinar will be emailed to you and the contact details will be written. So feel free to reach out to us. My colleagues and me, we will get in touch with you and start communication. Kavita, that's what I was saying. See, everybody remembers the ban, but nobody remembers the reversal. No, there is no ban on cellular therapy. There was never a ban on cellular therapy. What happened was there was a medical officer in the local municipal corporation who, on wrong grounds or illegal grounds, stopped our functioning. Within a day, we appealed to the health minister of the state, who reversed the order instantly. So there was no ban on cellular therapy. It was just a individual who was corrupt who stopped our functioning, and our work stopped only for a week, not more than that, and we've been functioning throughout otherwise. In fact, the High Court of India has recently given a statement that cellular therapy for autism should continue for those who are already taking treatment. So that's a very landmark positive judgment which has come from the court on an appeal made by some of the patients' parents. How early do we need to book appointments? As early as possible. December is a bit crowded. So if you're looking for January, I would suggest you do it now, because December, January seems to be a very, heavy period. So please reach out to us as soon as possible. Alima, the cost of the treatment, the coordinator will call you and explain to you all the logistics by next week for sure. Do we recommend doing HBOT session before the cell therapy for autism? Not necessary. Is around the time of treatment, as close to the procedure as possible. So generally, the more productive way is look at the brain, do the cellular therapy, and do oxygen-based therapy. Okay, but we need to do the PET scan before we start any oxygen-based therapy, is what we believe. Because if we do very close to the cellular therapy, the oxygen-based therapy, the scan results fluctuate. Okay, so you can do if you have a possibility, but keep a gap of a week after the HBOT to do the actual PET scan. There's so much success advice, FDA is still not approving. Sneha, I will ask one of my colleagues to send you a video where Dr. Sharma is explaining this beautifully. Okay, number one, FDA. If you're talking about US FDA is Food and Drug Administration. What we are doing is autologous cellular therapy, and it is a procedure. One of the federal government courts in the US has in fact given order saying that surgical procedures do not come under the FDA. Okay, the FDA will look at only drugs. What we are doing is a procedure. If we use cells which are multiplied outside or stored somewhere, then those become drugs. So what we do, it actually doesn't come under the US FDA purview. So there are, even in the FDA document, it is written, as well as it is a judgment given by the one of the US federal courts. So those are, it actually doesn't, the question itself is incorrect. So it's a surgical procedure which does not, it comes under the purview of the clinician who's doing it. Do we need to repeat the treatment again every 6 months or year? Depends on the severity of the condition. As I said, we will need to evaluate how the brain functioning is and whether there is a need for another treatment. Sometimes, yes, you may need to repeat it, but it varies in every patient, every child. Yes, Madhuri, you will be getting the recorded video. Thank you for all the questions. It means that you are interested and you have listened to the webinar. And those who have come in late, as I said, the video, please do go through the video and you can get in touch with us and we will answer your queries. So there is no ban on cellular therapy and we are functioning. That is a message, positive message you must circulate. Okay, so if we are done, then thank you for attending this webinar. Is there one more question here? Sure, Rachel. Everybody who has registered will be getting. Kavita, should we stop the medicine before cellular therapy? No, please do not stop any essential medications. The only medications that we suggest to stop would be blood thinners, if the individual is on blood thinners, number one, or if there are any cytotoxic or immunosuppressants which the individual is taking. Sometimes for skin infections, children do take who have autoimmune conditions or eczemas. So immunosuppression and only this. Avoid vaccination for 4 to 6 weeks before and after the procedure. Try and ensure that the child is healthy, doesn't have cough, cold, fever before the treatment or during the treatment. These are a few things you need to take care of. Please do not stop medications. Thank you, Sherry, Kavita, Madhuri, Rachel, all of you for being in, and have a great weekend. Thank you for attending.